Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Coronavirus. Introduction. Coronaviruses are viruses that can infect people and animals. Most people get these viruses at some time in their lives. They are common throughout the world.
Several different coronaviruses can infect people and make them sick. They usually cause mild to moderate upper respiratory illnesses. But some types of coronaviruses, such as SARS-CoV-2, can cause severe illness or death.
This program explains coronaviruses. It discusses the types of viruses, the symptoms they cause, treatment options, and prevention methods. Coronaviruses.
Human coronaviruses were first identified in the mid-1960s. There are several coronaviruses that can infect people, including alpha coronaviruses, beta coronaviruses, SARS-CoV-2, which causes the disease COVID-19, MERS-CoV, the coronavirus that causes Middle East Respiratory Syndrome, or MERS, SARS-CoV, the coronavirus that causes Severe Acute Respiratory Syndrome, or SARS.
The common cold may be caused by over 100 different viruses, including human coronavirus.
SARS-CoV-2 was first found in Wuhan, China in late 2019. This type of coronavirus can cause illness and death. The illness it causes is called COVID-19.
MERS is a viral respiratory illness that was first reported in Saudi Arabia in 2012. Most people who have been confirmed to have MERS-CoV infection developed severe acute respiratory illness. About half of these people died.
SARS is a serious form of pneumonia. It is caused by a virus that was first identified in China in 2002. Infection with the SARS virus causes severe breathing difficulty and sometimes death.
Coronaviruses may also infect animals. Most coronaviruses usually infect only one animal species or a small number of closely related species, but SARS-CoV can infect people and animals such as monkeys, cats, dogs, and rodents. Most people will get infected with human coronaviruses in their lifetime. Young children are most likely to get infected. You can have multiple infections in your lifetime. Symptoms.
Human coronaviruses usually cause mild to moderate upper respiratory tract illnesses, but some types of coronavirus can cause severe illness or death. Symptoms may include cough, fever, runny nose, shortness of breath, sore throat, fatigue.
Common colds caused by human coronavirus do not usually cause fevers except in young children.
Coronavirus viruses can sometimes cause lower respiratory tract illnesses such as bronchitis or pneumonia. This is more common in people with cardiopulmonary disease or weakened immune systems and in infants and the elderly. Symptoms usually happen about 2 to 14 days after coming in contact with the virus. People with active symptoms of illness are contagious, but it is not known for how long a person may be contagious before or after symptoms appear.
SARS and MERS can cause severe illness. In addition to common symptoms of coronaviruses, SARS and MERS may cause a fever greater than 100.4 degrees Fahrenheit or 38 degrees Celsius, chills and shaking, headache and muscle aches. Less common symptoms of SARS and MERS include a cough that produces phlegm, diarrhea, dizziness, nausea and vomiting.
See a healthcare provider if you develop a fever or symptoms of lower respiratory illness, such as cough or shortness of breath. Call your healthcare provider before the visit to protect others. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Human coronaviruses are most likely spread from an infected person to others through the air by coughing and sneezing, close personal contact such as touching or shaking hands. Coronaviruses may also spread by touching contaminated objects or surfaces and then touching your mouth, nose, or eyes. People usually get infected with human coronaviruses in the fall and winter, but you can get infected at any time of the year. Diagnosis. Your healthcare provider will ask about your symptoms as well as your personal and family medical history. If you have traveled abroad recently, tell your healthcare provider. If you think you have COVID-19, see your healthcare provider right away. Call the office before you visit to protect others. Your healthcare provider will perform a physical exam. If you have SARS, your healthcare provider may hear abnormal lung sounds while listening to your chest with a stethoscope. Laboratory tests use body fluids such as blood to help confirm the diagnosis. Imaging tests may also be done. These include X-rays or CT scans. Treatment. Severe cases of coronavirus infections may need to be treated in a healthcare facility. Most people with coronavirus illness will recover on their own. Some things can be done to relieve your symptoms, such as taking medicines to relieve pain and reduce fever, using a room humidifier or taking a hot shower to help ease a sore throat and cough. If you are sick, stay home and rest. You should also drink plenty of fluids. If a person has or may have SARS, MERS, or COVID-19, they should be kept away from other people. Treatment for SARS and MERS may include antibiotics to treat pneumonia, antiviral medicines, high doses of steroids to reduce swelling in the lungs, oxygen, breathing support, or chest therapy, other treatments specific to the disease and symptoms. In some serious cases, the liquid part of blood from people who have already recovered from SARS has been given as a treatment. Complications of SARS and MERS may include respiratory failure, liver failure, or heart failure. Long-term complications may develop. Treatments may be needed to treat these complications. Prevention. Avoid traveling to places with coronavirus outbreaks. Vaccines against COVID-19 are available. They offer protection against severe illness and death from COVID-19. The vaccines may be given in a single dose or in a series of 2 doses spaced weeks apart. You may be able to prevent the spread of coronaviruses by washing your hands often with soap and water. When you are sick or are around people who are sick, you should avoid close contact with them. Avoid touching your eyes, nose, or mouth. Wear a mask or goggles. Do not share food, drinks, or household items with someone who is sick. If you have an illness caused by human coronaviruses, you can help protect others by avoiding close contact with other people and pets, covering your mouth and nose when you cough or sneeze, keeping objects and surfaces clean and disinfected, staying home while you are sick, wearing a mask around others. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Coronaviruses are viruses that can infect people and animals. Most people will get infected with human coronaviruses in their lifetime. Young children are most likely to get infected. You can have multiple infections in your lifetime. Human coronaviruses usually cause mild to moderate upper respiratory tract illnesses, but some coronaviruses can cause severe illness or death. Symptoms may include cough, fever, runny nose, shortness of breath, sore throat, fatigue. Human coronaviruses are most likely spread from an infected person to others through the air by coughing and sneezing, close personal contact such as touching or shaking hands. Most people with coronavirus illness will recover on their own. If a person has or may have SARS, MERS, or COVID-19, They should be kept away from other people. Treatment for SARS or MERS may include antibiotics to treat pneumonia, antiviral medicines, high doses of steroids to reduce swelling in the lungs, oxygen, breathing support, or chest therapy, other treatments specific to the disease and symptoms. Vaccines against COVID-19 are available. They offer protection against severe illness and death from COVID-19. The vaccines may be given in a single dose or in a series of 2 doses spaced weeks apart. You may be able to prevent the spread of coronaviruses by washing your hands often with soap and water. Avoid traveling to places with coronavirus outbreaks. You should also avoid close contact with people who are sick. Thank you for using Explain.